Welcome to the Turd Nerds podcast. You are tuning in to the Functional Gastroenterology podcast with hosts Dr. Ilana Gurevich, Dr. Ami Kapadia, and Dr. Rebecca Sand. Let us tell you quickly who we are. I am Dr. Rebecca Sand, a naturopathic physician, acupuncturist, and educator based in Portland, Oregon. My practice specializes in the microbiome, hormone conditions, and conditions of the gut-brain axis.
I'm Dr. Ami Kapadia. I'm a medical doctor trained in family medicine and holistic medicine with a special interest in digestive health, the microbiome, and its effects on our overall health.
And I am Dr. Ilana Gurevich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, irritable bowel syndrome, and other functional GI disorders.
Okay, let's take the plunge into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Okay, welcome back, everyone. We are so excited to be diving into season 3 of the Turd Nerds. We have quite the lineup here for you guys.
We've had really fun, relaxing summers.
Yep.
I went back east. What did you guys do?
I overbooked myself, usually underbook or overbook. This year was overbooked.
Yeah, I think
fun.
I'm in the same boat. But still relaxing. And I feel like we saw a lot of cases we've been talking about that we can't wait to share with you and discuss on this podcast. Yeah. I would like to just start with a brief, quick, tiny story here that this morning, my partner, when we were getting up, he turned over and asked me, "Hey, are your turds coming over today?" Which is you guys.
I feel like my work is done. If people are looking at me and referring to me as a turd, my work is done. I've achieved it.
You are officially my turds.
Thank you. And I wear that badge with honor.
Yeah. Oh, it's so great. Well, today I'm excited to announce we are going to hear from our one and only Dr. Ilana Gurevich, who is going to be telling us a little bit more about Secretory IgA. And I think we should just dive in. I have a lot of questions.
Yeah.
I'm confused, and I'd love to hear about testing and treatment.
So let me just backtrack with why. Why am I... This is obviously going to be a really niche podcast. You know, some of our podcasts are like broad spectrum. They hit everybody. The fatigue podcast, the constipation podcast, which 3 seasons in, is still our number one listened to podcast.
People are
There's a lot of constipation.
You know what
else?
Not enough fiber, not enough fermented food. But the reason why I started looking at this is because years and years ago, I did a really deep literature dive on functional testing.
Sorry, my water bottle keeps squeaking. If anyone's wondering what that noise is, I'm going to keep the lid off.
That's
Go
not
ahead,
a little
Dr.
bit of
Gurevich.
maldigestion.
Trying to hydrate here. It's rough.
So I started doing a literature search on, you know, all of the testing that we're running through our functional stool testing. And I was trying to figure out which one of those tests have value and which one of them don't. Mm-hmm. And Secretory IgA came back with like an asterisk, mainly because I called 4 or 5 different specialty labs and nobody could tell me what Secretory IgA they were running. Oh. Were they running free? Were they running bound? And then on top of that, my other question was, like, I know you measure Secretory IgA in the literature, and I know that it definitely plays a role in different functional and organic diseases, but I guess I was like, do I care?
And did you specify that we're talking about fecal?
Sorry, yeah.
As opposed to what we get on a normal blood test?
So this podcast is, I'm just going to cover Secretory IgA as a whole and then like nail it down into what we see in the GI.
Okay.
But when I was calling for the functional stool test, I was only asking about fecal. So
what is Secretory IgA?
I was just going to say that, Dr. Sand. Thank you.
Let's define things
So
first.
Secretory IgA, it stands for secretory immunoglobulin A, which is basically an antibody that's found in the mucous membranes. We see it aggressively in the respiratory tract. We see it aggressively in the gastrointestinal tract, but we also see it in breast milk, in the vaginal tissue, really any place where we have mucous membranes. And in the GI tract, it happens to be the most abundant immunoglobulin there. What we know about is that it acts as one of the biggest barriers of the defense system. So it's basically our body's way of protecting us against pathogens. So the reason what got me interested, or what made me slightly aggravated about our functional lab test, what made me slightly aggravated about our functional lab test is that nobody out of the 5 labs that I called, only one of them could tell me that they were testing the free secretory IgA and not the bound.
I have had similar experiences when I've called some of our functional medicine labs about other things, like, hey, I'm getting like all positives on this test.
Totally.
What is the percentage of that you've gotten? And they can't tell me. And I'm like, you run this lab.
How are you not collecting this data?
Well, so here's the way that I always rational out is I very rarely get put through to the medical director.
That's true.
Like customer service
Right.
is somebody who doesn't really know what the medical director is making choices for. And I think that if I asked to get connected, I generally would get connected. I just kind of don't have a lot of time.
But they should be able to give us the stats.
Right. And I feel like I did email with the medical director and said, hey, I'm getting all these positives. Can you tell me how many negatives you get? And they couldn't tell me.
Oh, really?
Yeah. It was on an IgG, which is controversial anyway. An IgG panel I was using, I can't remember exactly if it was foods or mold or what it was, but I wanted to know what their rate of negative results was, and they couldn't tell me.
Yeah, and that is this, I feel like if we're looking at where people who are not involved in the functional or integrative space, what the criticism is we don't, like, when we're looking at like stool testing in particular, which is where I live, the library of pathogens that they're using is like grossly different than like a library of pathogens through like Quest or LabCorp or ARUP or any of these standard tests. And that is really... that's a frustration that I have,
It's like a smaller data set, and they probably don't have the funding and such, but still,
and
if
where
we're going to use them...
are they getting their reference ranges?
Right, that's the other question we've
And oftentimes,
asked.
I think that they get their reference ranges from their internal staff to start with, and then they build their reference ranges from...
So that needs to be public information, is like what their population is they're basing this
Right,
off
because
of.
if they're basing it on everyone we're sending a stool test on, all of them have problems.
Here is the other side of that. Not to be a
Slight
devil's
bias.
advocate, not to be a devil's advocate, but the other side of this is every lab is only basing their ranges on the people that are coming into their lab.
That's true. So even the regular, regular sort of our big labs there's questions about, are these the right LFT ranges, or, is it America... Does America have healthy LFT range?
Yeah.
And not only that, but I'll send a patient to a Quest in Northwest Portland, and then I'll get them rejoined in a Quest at Southeast Portland, and they're the exact same number, but one of the Quests flags it and one of them don't, because they're actually just basing their ranges on whoever's walking into their lab.
That I didn't know was so limited, like geographically limited.
It is exceptionally interesting. It is literally lab location specific.
And it's so frustrating because patients and a lot of times even other providers will look at it and say, nope, your whatever was completely normal. And I'm looking at it and say the medical literature is very clear that under 30 is low for this marker. But, Quest or Providence or whomever is different.
And so I'm going to say, I do believe that our functional labs should get a lot of flack. I feel like we should absolutely be questioning the validity of them. And I also want to just say, all labs have a lot of the same criticism.
Totally. It's true.
We shouldn't throw away the baby from the bathwater.
Yeah, and I do still find those labs helpful that I couldn't get the data from, because we we gain our own experience in how to interpret them, even if we don't have maybe all of the data that we want. Just from ordering it on hundreds of people, we can see trends ourselves just from our own patient population.
And the huge caveat, it's all we've got.
Right. There's that.
It's the best we've got currently.
And that's an interesting conundrum, because I've been doing this a long time, and I have changed my stool testing that I've run from like when I started practice 18 years ago till now. And back then I was like, those stool tests were really useful and I got good results. And now I was like, this stool test that I used to use is garbage. How did I ever get good results? But it does direct a clinical trajectory.
It's something.
Right.
Especially when there's a confusing picture of what's going on, and just history alone is not sufficient to make progress, which sometimes it is and sometimes it's not.
Yeah.
I think the takeaway is we can't hang everything on these results.
Definitely not.
It has to be a comprehensive approach.
And every sample is only as good as the poop that we collect.
Totally.
And that changes.
Also just our pre-test probability of what we're looking for affects how we interpret the test result, right? So we don't want to be that would make it challenging to just get a clear data set of reference ranges, because we're not going to be sending samples for people that don't have any problems. So.
Right. That's also true. Okay. And all of this is very relevant to secretory IgA.
All right.
So let me just give big picture. Big picture is secretory IgA is one of the most important aspects of the immune system. 75% of it should be bound and 25% of it should be free. So let me just explain what bound versus free means. And now I'm kind of going into the GI tract. So this is all of my data, or all of my research has been around the GI tract and the secretory IgA there. Bound secretory IgA basically is an immunoglobulin that's bound to either some kind of healthy microbiome bacteria or some kind of pathogen, right? And actually, this is one of the ways that the body stabilizes the immune system within the GI, because if we're looking at the GI from an immunological perspective, it's kind of crazy. You know what I mean? Like, as humans, we are literally 10 times more bacteria than we are human, right? That's not saying anything about viruses or phages or anything else. Just bacteria, there's 10 times more DNA of bacteria than there are human. On top of that, the human is completely reliant on the healthy flora that's in the microbiome. And on top of that, the microbiome can go pathologic, and the human has to be able to differentiate when it's dealing with a good guy or a bad guy. It's very complex.
Yeah.
It's like you walk down the street and 75% of everybody you see is fine, but 25% of people are dodgy, and the immune system has to be able to differentiate it.
Yeah, I struggle with it.
Right.
The people on the street or the gut bugs?
Both.
Or both?
Both.
And so the way that the body navigates this is we want about 75% to be in the bound state. We're holding on to our good guys. And we want 25% to be like feeling around and looking for a bad guys. And when it finds a bad guy, it really gives a message to upregulate and say something needs to happen here, right?
Makes sense.
To start, and this is where autoimmune diseases go wrong, because with autoimmunity, the body's not doing that correctly, and it's not seeing the bad guys.
It cannot differentiate self from non-self.
Right. And so the role of secretory IgA within the GI tract is multifaceted. The first role is it acts as a barrier, right? It is trying to bind up other pathogens or other bacteria to prevent them from entering into the mucous membrane and, from what's like dissolving through outside into the lining to get into the body. It's trying to at first stop anything from going forward that's not supposed to. It also is acting with an immunological defense, right? So when it finds one of these bad guys, it binds to them and it says, oh, I know you. You're a bad guy. I got to tell the army that you're a bad guy. Let's throw you in jail. So it really is there to mitigate the immune function of the GI. The other thing that it does is it's there to maintain the microbiome, right? So it's there to say, oh, you're a good guy. I'm going to go let you do your thing. Go reproduce. Go make babies. Go start a family. You know what I mean? Like, you're free. Go do what you want. And the way that I do that is I bind up the bad guys and I, put them in jail so that the good guys can do what they're supposed to do. The next thing that it does, which is very, very important, which is one of the things that has gone wrong with humanity and Western culture in the last 30 years.
Can't wait for this.
Only the last 30 years?
It's the hygiene hypothesis.
Oh, okay.
Right?
Gotcha.
So it's the goal of secretory IgA is to benefit immune tolerance, right? So basically the job of secretory IgA is when it binds, it says, is this me? Is this not me? Okay, this is not me. Is this something I need to live? Is this one of the bacteria that's going to be good for me? Or is this food? And if it sees it as food, it tells the body to be tolerant to it, and then you don't have allergies to whatever you're eating, right?
Okay.
This is one of the reasons why actually having dogs in the house with babies is good,
Yep.
because it exposes them to other things while their immune system is in training, so that they can get tolerance and not end up with basically eosinophilia, asthma, allergies, the triad, eczema. That really is secretory IgA's job, or one of secretory IgA's jobs.
To build tolerance.
And I will say, Alana, you are walking the talk here. You came into my house and encouraged my baby to be playing on the floor with the dog hair.
I was concerned about a possible choking hazard and hairball.
We all had our different perspectives on that, but from a microbiome standpoint, you got a point.
Now,
maybe just lick it.
And your baby happens to be the perfect age to be eating dog hair.
Okay,
The perfect
all right,
age.
so gross. But...
The other thing that it does, talking about the baby, is it does actually play a big role in maternal immunity. So secretory IgA through the breast milk is how the baby develops tolerance. This is why it's really, really important to nurse up until 6 months.
Yep, for those who are able.
For those who are able, because the baby doesn't have an immune system on purpose. It's got when babies are born, they're like, from a Chinese medicine perspective, we think about them as completely all spleen, or spleen basically translates to like GI. Like their GI is supposed to be really porous so they can get all of the mom's nutrition through the breast milk. And, even when a baby can't be breastfed, the industry is starting to realize that we need probiotics in there and DHA in there. And, it's not 1950s when when I was born, my mom couldn't nurse me and she got cornstarch and water.
I know.
That's what they fed me is cornstarch and water.
Coronation, like instant milk or whatever that was.
Yeah. I wasn't even that. This was Soviet Russia.
Just give them a Thai iced tea, whatever.
I can't think of a baby that's not going to love a Thai iced tea or a mom that's not going to love having a baby who just drank a Thai iced tea.
Yeah, that would backfire.
And then, the other thing that it does is it really mitigates the inflammatory process. So it prevents excess inflammation, but it also upregulates inflammation when it's necessary, really in correlation with being exposed to a pathogen.
So it's sort of like the barrier between the stuff coming in and your immune system.
Exactly.
It's like it's calling the shots on when we need to get more help in, when we need to recognize, okay, no, this thing's probably okay. Like, let's rope this into our list of good people, like the people let into the club.
Yep.
And it will alert the authorities
of the bad guys
if we need to.
And do you talk about it in the context of other immunoglobulins, or are we just really focusing on IgA specifically today, or do you want to kind of touch on the others?
I kind of, the reason why I wanted to go down the secretory IgA path is just because we're testing it. I actually can't think of a functional stool test, any of them, that don't have secretory IgA.
Why is it called secretory?
Because it's secreted from the mucous membranes.
Oh.
I think.
And the other ones, IgE, IgG, etc., are just not part of like our standard. I mean, we talk about it with allergy, but it's not something we measure as part of sort of functional GI testing.
So let me give you my spiel on the other immunoglobulins. I also just want to plug Heather's Wiki.
Right.
If anybody has ever had the opportunity to study with her, she's a genius who has this incredible ability to make complex issues, especially immunological complex issues, very simple. So the way that Heather's Wiki described it this was like 2 decades ago when I was in school, was we start with IgM, right? And IgM is this little 5-handed immunoglobulin that rolls around your immune system and it grabs onto 5 little things and it says, is this me? Is this not me? This is me. Done. This is not me. Okay, then immunoglobulin M has to make a choice. Is this something I need to form a reaction to, like a virus or a bacteria, right? Okay. And that's like a slower response. That's like I'm not feeling good. I'm feeling really bad. I come down. I'm sleeping a lot. Now I'm feeling better and I'm back to myself, right? It's like this slow 3 to 5 day curve that goes up and then comes down. The other thing that could happen, and actually I probably should have said it first, is IgE. This is not me. This is very dangerous. I need to deal with this right now. Yeah. My lungs close up. My throat swells. My mouth swells. This is an allergy, a real allergy. Yep. As opposed to IgG, which is like a hypersensitivity. IgD, from last I looked, they don't know what it does. I think maybe there's some new research coming out about it, but I don't know what it does.
And I feel like she has a particular opinion on IgG and whether or not that should be used as part of sort of sensitivity workup. But that's probably for another day.
I feel like IgG is its own beast.
It's its own animal. Yeah. Okay.
And then there is
We could interview her and ask her all these questions.
She is so good.
Okay.
She's smart.
Then the last thing is IgA. IgA is oral tolerance. That's what we were talking about with secretory IgA.
Right.
It basically pushes oral tolerance, which means this is not me. This is something that I need to live. I need to not form a reaction to this. And what has happened since we've come into this world of hypersterilization and cleaning everything with Lysol and this and that and not giving our kids dog hair to eat, what has happened is that there used to be this balance in the immune system between IgE and IgG, or allergies and hypersensitivities, but the majority of your immune system was IgA or tolerance. And now we have this balance between IgE and IgA, so hypersensitivity and tolerance, and the majority of a lot of people's immune system is IgE or allergy.
Or IgG as well?
No.
That's not part of that.
It's the hyperhygiene philosophy. We've killed off all the bacteria.
Got it.
So our immune system's not exposed to it.
Right.
And so when it forms a reaction, instead of going tolerant, it goes allergy.
Yeah.
And this is food allergies. This is MCAS disorders. This is anaphylaxis. This is asthma. This is eczema. This is what we always talk about.
Environmental allergy.
Yep. This is the environment. This is the allergic triad.
Yeah. Bad news.
Bad news. So let your kid eat dog hair.
Okay.
Or just have a dog in the house.
Yeah.
Have a dog in the house is actually eventually if you have a dog
And
in the
don't
house,
use a dishwasher.
Every time.
That's the other one. There was a study that showed the same kind of thing if you hand wash dishes.
Yeah, but there are so many disgusting things growing in dishwashers.
Wow.
Okay, I would
No,
also
I'm
saying don't use a dishwasher.
But it has so many microbes.
Oh,
in
you
it.
feel like it'll give you more tolerance?
Have you seen a dishwasher filter?
I have. They're
I have
disgusting. And we got rid of our dishwasher.
You got rid of your dishwasher?
Yeah, one
Listen,
more potential.
I would like to point out, everybody talks about all of the inequalities. I'm going to say this is the inequality of not having a child.
Yeah.
If you have a child, getting rid of your dishwasher.
True.
We're running ours once a day.
That's true.
At least.
Yeah.
That's
You're tough.
understandable.
I mean,
I feel like there's very few things that I could live without.
Yeah.
No, I can live without many things. I can't live without my dishwasher.
It makes sense
Or-
if you got
or
kids. You have
thanks
like
to-
20 kids in your house.
5, but yeah. Thanks to these guys, also now my Dyson has come on that list.
Hey.
My Dyson vacuum, I
Oh,
have
yeah.
no financial...
You're welcome for the
Cordless
20 hours
vacuums.
of research.
Yeah.
Yes.
Selection of model type.
I love mine. This isn't sponsored by Dyson.
No, but
Cordless
obviously...
vacuums did change my life.
Oh, yeah.
Yep.
I enjoy vacuuming now. I
know.
hated the cord situation is
really brings you down.
This is truly a
with anything,
Western...
a lawnmower, an
Speaking
extension
of
cord. I'm not a fan of
over-cleanliness here.
cords.
Maybe audience don't get a cordless vacuum if we want those germs.
Right. We want your immunoglobulins to be balanced, so let your house be dusty. We won't do it, but
I will say I'm allergic to dust mites, and maybe
Who isn't these days?
I know. Stop
Because
vacuuming,
The
people.
hygiene hypothesis.
because of the hygiene hypothesis.
Excessive use of antibiotics.
Okay, so now we know what it is. Do you guys, is that pretty clear?
Yep,
Okay.
yep.
I question how long people are going to stay on this episode because it's like so specific. But okay, let's talk
They're
about.
getting all these other tips
but
on.
I will say there are a lot of things on the market, supplements that aim to or like say they're
that's
going
the
to help.
end of our.
Secretory
That's
IgA.
the end of our
So I
conversation.
want to know what to do
Great.
with those.
First, I feel like that's a great question, but shouldn't we first talk about why it's suppressed and why it's high?
Okay, fine.
Yeah.
Why is it low? Why is it high?
Aren't
Right.
there like a million reasons? Though?
Yes.
And a lot of them are like perfectly fine.
And a lot of them are exactly the same.
Okay.
So why don't we start with first, why is it high?
Isn't it better that it's a little bit high than low? Just because.
So my answer is it does kind of demonstrate different stages of a disease.
Right.
I mean, honestly,
If we were going
really...
to pick one to have,
So do you guys want to take some guesses? Why would secretory IgA be high?
infection.
Infection is a great guess, Dr. Cavadia. Great.
More acute, but I feel like once you get just overwhelmed with the infection, it could become suppressed.
It is almost like you wrote this episode.
Wow.
Autoimmune disease?
Autoimmune disease is definitely, we see an
Pregnancy?
elevation in IBD. Do we see...
Do you think it mimics a little bit of how we think about cortisol?
So wait, I'm sorry. Yes, pregnancy is correct. So wait, just to recap.
3 points for me.
Pregnancy,
Yep.
chronic disease, acute infection
Yep.
in the acute stage, not in the chronic stage, autoimmune diseases in the initial stages, not in the prolonged stages. I said breastfeeding. Do you guys want more or no?
Yeah, I want them all.
Allergies.
Yep, that makes sense.
Vaccination. We are looking post-vaccination for a spike in immunoglobulins.
Yeah, makes
For
sense.
efficacy.
So to show, and that if you're looking at how we're actually tracking the COVID vaccine, we're looking at the spike in antibodies.
Got it.
Stress, either physically, is either emotional or social emotional stress in the acute, but also exercise.
Oh, yeah.
Exercise is a physiologic, completely normal elevation of your
If a
secretory
patient
IgA.
just like worked out and then tested their secretory IgA, it could be high.
Absolutely.
What about loose stool?
Loose stool, depending on the underlying cause.
Got
Is
it.
it being caused by an acute infection?
Right.
Yes. Is it being caused by an autoimmune disease?
Yep.
Yes. Is it being caused by an inflammatory process? Yes.
So IBDs. Yeah.
Or even IBSs.
Celiac disease.
Yes.
Yeah.
In the acute stage.
Yep.
So will you address my comment about
Back to me
Do you
here.
think it all mimics how we think about stress and cortisol with the acute elevation in cortisol during acute stress, and then over time, if you just are on unrelenting stress, eventually your cortisol levels can go down? It seems like it could follow a similar pattern.
I think it doesn't seem like it does.
Okay.
It does absolutely follow a similar pattern.
So probably along with like adrenal insufficiency.
Yes.
Or however we want to call that,
Yep,
whatever the current trade name.
Burnout is what we call it.
Oh, yeah. Burnout and sabbaticals.
Yeah.
I'm not out of work,
yeah,
you
sabbaticals
said, right?
Sabbaticals is a thing.
Okay.
Okay, and then the only ones that we are missing is environmental exposures, being exposed to any kind of pathogenic toxin. Obviously, it's acting as a disruptor, including to the microbiome.
Yep.
And then dietary antigens. If you are either hypersensitive or allergic to some kind of food or a lot of foods, then that can also spike your secretory IgA. So that's elevation. Can we then extrapolate into suppression?
Yeah, I think you had an infection
Steroids.
or autoimmunity for a long time, and it just can't keep up anymore, kind of like the cortisol picture.
Yep.
After a recent infection?
So prolonged infection.
Okay.
So, what's going to happen with the immune system is it's going to rev, but there's nothing can rev forever.
Right.
And so it's just going to lose its steam and then it's going to go low.
Gets depleted.
So chronic infections, also chronic stress.
Yeah.
Same as that cortisol picture.
Yeah. Steroids?
Immunosuppression, absolutely. Yep.
Lots of drugs out there.
Aging, getting older, just,
Along with
immunosenescence.
everything else.
Yeah.
Yep, immunosenescence. Autoimmune diseases, prolonged chronic allergies. So basically
Wait,
everything.
you said autoimmune disease.
Prolonged autoimmune
got it,
diseases.
got it.
Sorry,
Yeah, not
so
the acute.
not the acute, but if you're uncontrolled for a prolonged amount of
Yeah.
time, your immune system just starts puttering out.
Yep, makes sense.
Some medications, immunosuppressants in particular, which we talked about with steroids, and then chronic GI infections, and then also just the obvious is, immunocompromised or immunodeficient people, they're immunodeficient, which means they're also going to have an immunological deficiency of their GI, of their immunoglobulins.
Right.
So when we're looking at labs, are you asking people all these questions? Like, did you recently work out? Are you pregnant? Tell me about steroids.
So what I'm starting to understand, that's the nice thing about being an expert in something is you get this nuanced view.
Yeah.
And what I'm starting to understand is the preparation that I need to tell patients to do
right.
has to include these things.
Yep.
I just wanted to throw in there, when we, for
if you're
different
pregnant,
reasons.
We just throw that value out. We just
Yes,
can't
exactly.
interpret it. Yeah.
Exactly.
I just wanted to throw in there, we check standard Secretory IgA blood testing whenever we do our celiac screening. And it's very rare that I've ever seen a low, at least blood test level,
I've seen
which
it.
is, it's there, but it's not, it's pretty rare that I can't use, because we order that test so we can properly interpret the levels of tissue transglutaminase IgA. And it's been pretty rare that it's been low compared to the times I've seen it low or high in a functional stool test, just as a observation.
I see it low and high often
In blood. I would like to
Interesting.
just right now plug our celiac episodes
Totally.
because that was an episode. I always tell people, I'm like, this is a podcast where if I'm actually learning things every week, I'm like, oh, this is a good podcast. Not to plug myself. But that was a great episode because I was like, why do I run? Why are these the 5 tests?
Right.
And it made me be like, oh, the total secretory IgA, that's giving me a baseline
Yep.
for everything
It's like
else.
a control.
Yeah, I re-listened to that one as well.
Yeah.
And I test for celiac all the time.
Yeah, me too now. Okay, so now let's get to what everybody really wants to hear about, which is what do we do about it?
Yep.
And here's the bummer of what I'm going to say. There is not a whole lot of data in the literature about what we do about it.
Got it.
So a lot of what we do about it is common sense based.
Okay.
Right? So what did I find data on controlling secretory IgA? There's, the first pool that I like to put into is like this is pretty obvious. Eat a good diet. Don't put a bunch of pesticides, poisons, preservatives into your body. That will make your immune system be controlled. Stay hydrated, mainly because with bowel movements and with the microbiome and with the immune system, which is controlling the microbiome, you want to float the boat to get it out. If it's sitting there, that's obviously going to change the microbiome and lead you more to being sick. Maintain stress, maintain good sleep, and exercise. So that's like the live like a human. That's I put that in my live like a human pool.
Yep.
And that actually could make a huge difference for everything, including secretory IgA.
Yeah.
Then there's like the other live like a human before we were into better living for chemistry. So avoid antibiotics, avoid non-steroidal anti-inflammatories, don't drink too much alcohol, don't smoke too many cigarettes, like all that kind of stuff.
Keep your inflammation low.
Okay, so those are my lifestyle for everybody, for every condition, for anybody who's ever lived, like just the duh. Can I just say a quick story? Last night I was at a bat mitzvah for my daughter's best friend's sister, right? And they were giving out desserts and they were making s'mores. And I was sitting with a nurse practitioner friend of mine that we were just, gossiping. And her daughter comes over with s'mores for like all the adults at the table.
Oh, that's nice.
And the nurse practitioner takes one and hands it to the person over me.
Oh.
And she was like, "You're obviously not going to eat it, right?" And ironically, I totally would have eaten it if I wasn't doing No Sugar September.
Yeah.
But
I love s'mores. I really love s'mores.
Don't poison yourself.
What?
Okay, so that is like the obvious duh lifestyle. The other things that we need to do, or that could potentially be a help, is like supporting the microbiome. Probiotics, prebiotics, fermented food.
Yep.
Fiber, yep, that's prebiotics.
Yep.
And then also the stuff that we do to support the immune system, vitamin D, zinc, glutamine, fish oil, stuff like that. And then finally, stuff that supports inflammation, like bioflavonoids, like anti-inflammatory herbs, stuff like that could be helpful. However, none of these things have good, clean data. All of the supplements, maybe outside of probiotics actually do have some data behind it. Not really high quality data, but still data. Outside of that, everything is an extrapolation of this is what went wrong. This is what the immune system does. This is what went wrong. This is what we know support the immune system for other aspects of life and health. So let's try it for secretory IgA.
So my take on this has been, if it is high and we have some concern that it's high for just being high, not all the reasons you listed, why? Like, let's figure out why, fix that problem, and carry on your way. Like any sort of gut repair, microbiome repair I'm going to be doing at the end of a treatment for people, I kind of just figure is going to take care of this and the immune system's going to restabilize itself.
That's I would agree.
Okay, so like the basics. There isn't... Okay, so what the heck with all these supplements... like bovine immunoglobulins.
That's for IgG though, isn't it?
That's an IgG.
That's maybe a different...
But would I use it to support secretory IgA? Yes, because I would use it for chronic infections.
I mean, people really do respond from that one.
And I will also say SBIs, if you want to look at something with truckloads of data, there's truckloads.
For IBD, right?
For IBD, and for other immunological
I think there's
conditions.
there's a prescription.
Yeah. I think probably more than one.
Yeah. I see it help with constipation.
I see it. You know what? I think I was like, you know what? I see it for like a secret with my travel protocol. I see it working with my travel protocol. We published that episode. So I guess let me tell you guys my take home, and then I'm gonna listen. I want you to hear your guys' take home. My take home is this is an important factor. It maybe hints us to look for chronic infections if it's high or revving, and basically it's not like a huge thing to hang your hat on. That's where I'm at.
Yeah, I think it's sort of like you have to take it in context with other things that you know about the person. They're telling you what else is going on in their GI, maybe the other results. If it's indicating, try to pin it on something.
Right.
Rather than just treat it in and of itself. Otherwise, sort of the basics, just take care of yourself, take care of your microbiome, will probably take care of this in the end.
Dr. Kapadia, any take-homes?
Yeah, I agree. I think just keeping it in context and don't become like a Secretory IgA specialist. I remember there would be like an H. pylori specialist. Yeah. And just keep it in context of everything else that's going on. And if you do suspect an underlying trigger or pathogen or just general lifestyle issues that you've identified, see if just doing all of those things will help it even itself out. I do wonder if someone getting treatment for allergies, since there's so many people with allergies, I think immunotherapy and allergy shots are supposed to help with that immune system balance. And we talked about with the hygiene hypothesis, how it gets shifted. So I wonder if that would help it over time in patients where all of these other things are in place, but they just have a lot of allergies.
Yeah. And play with dogs.
Yeah.
Right? Get a dog.
Get a dog.
If you have time.
Yeah, if you have time.
If you've made it through this episode, guys, good job. Good job.
Thanks for tuning in, everyone.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the turd nerd word.